know what you're good at, and know where you want to go. And for me, I had that goal of I wanted to be an executive leader. So all along, I knew I needed to learn how to manage people. I needed to learn how to manage budget. I needed to learn how to get money. I had to get results and publish results and present results. Right. So that was what my hit list was. But I also wanted to learn about HIV, and I wanted to learn about sexuality. And then I wanted to learn about collective impact. And so I was building a skill set. And I was also working in a variety of settings. I worked in housing projects. I worked for Planned Parenthood. I worked for 3 academic institutions. I worked for a federal agency. I worked for CDC. So that whenever there was a job that came up, I had such a wide skill set. I didn't pigeonhole myself to only work in a state health department or only work for CDC or only work in one place. And so for me, that worked out well because I always wanted to be employed.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Hey friends, welcome to Public Health Careers. In today's episode, you'll learn more about some transformational perspective changes from studying abroad to working in the Peace Corps to affecting systems change, the importance of collaboration and working with the right partners in order to affect systems change, showing how public health is political, yet why we still have to push on to make changes and just do it, damn it, the importance of that personal motto, and much, much more. Be sure to hit the subscribe button if you enjoyed today's episode or any other episodes so you can stay up to date with this great content. Be sure to share this with someone who get value from it, and leave us a review to let me know how you think the show is going. And if you'd like to support, there is a link underneath to support to become either a monthly or a one-time contributor of the Public Health Millennial and Public Health Careers. I know that you're going to get a lot of value from this episode, as I did, so enjoy.
Hi, everybody. This is M Nolte. I am a nonprofit executive and public health professional, and you've joined Public Health Careers.
Today, we have someone with extensive experience in public health, having worked at the global, national, state, and community levels, focusing on changing systems. After graduating from Boston University with a Bachelor of Arts degree in Hispanic Language and Literature, she joined the Peace Corps and served as a health educator in Guatemala. She then went on to get a Master of Public Health at Tulane University School of Public Health and Tropical Medicine. She currently is the CEO at Migrant Clinicians Network. Please welcome M Nolte, MPH, MCHES. Welcome to the show.
Thank you. Good to see you, Amari.
The pleasure is mine. I'm looking forward to hearing more about your journey and all the expertise that you have to share with us. So I'm really, really glad that we're able to chat today. So tell us, how do you identify?
I identify as she, her, and ella.
Okay, we're going to break out your interview into 3 decades, and we're going to have deep discussions since you've had a lot of experience in the public health field from a lot of different perspectives, which I'm very excited to talk about. And I know in the email you initially sent me, you said just how important fundraising has been in a lot of different roles throughout your career. So you've gained the secondary skill in fundraising. Why do you think that was important?
So fundraising is incredibly important when you're working in public health because there isn't always enough money to do the work, right? If you're working at a state health department, you may also need to supplement those funds with grants that are coming from foundations or coming from the federal government. And if you're working for a nonprofit organization, you definitely have to be raising funds. So you're looking for federal funds, foundations, and donors who support your mission. And so at some point in your career, you really need to learn how to fundraise. And that starts with learning how to write grants. right? How to write solid grants. And there's a skill set in writing federal grants, and there's a different skill set in writing foundation grants. They have a different feel to it, a different rhythm to it, a different expectation. And then when you start moving into the realm of fundraising with individual donors, that's a whole different other skill set where it's really built on relationships, and you're providing an opportunity for people to be generous. Now, many people are looking for an opportunity to make a difference in the world, and they're looking for an opportunity to be generous, and they're just waiting to be asked. You're not twisting people's arms. You're giving them an opportunity to do something that they were already going to do. And so it's really important to learn the art of being able to touch, move, and inspire people and invite them in to be a partner to solve whatever problem it is you're solving. And so these are all different skill sets that get honed over time, that most of us are learning it on the job. We're being mentored by people who have gone before us, who had started writing grants, or being mentored by people who are actual professional fundraisers.
That was really awesome. I love like the frame shift in like, especially when people think about fundraising from donors, they don't think they think about it as being like kind of salesy or just trying to ask for people. But when you really think about this is good work, people need to support this good work for it to keep going. How do we give them the opportunity and speak about it in a way that is both win-win for both sides, because they are looking for ways to get their money to be used in positive ways, and you are working for an organization that is doing positive work. So it's like, as you said, how to touch, move, and inspire. And I love that perspective, and that's really important. As well as, yes, there's so many different kind of fundraising and ways to get grants and funding. Myself, I work at a private health foundation, so I definitely know how the framing of grants coming in and like that kind of language and how you have to talk and how you have to like work with program officers to really like get on the same page to really say, okay, this is where we are aligned and this is why we're going to make this impact, and really understanding what you are trying to get and trying to share with those foundations is important. And as you said, working with whether that's state or federal grants are a lot different from working with foundation grants, and just understanding that nuance is very important. If you were to give like 2 tips for people that are trying to start fundraising, what would those tips be?
Well, I think it's really looking at the perspective of each funder. So, for example, with federal grants, you're solving their problem, right? So CDC is looking to solve a problem, and you have to write your proposal to solve that problem, not your problem, their problem, right? Foundations might have a strategy, or they just want to help young people, or they want to do something in the environment. So there's more leeway there, and that might be building a relationship with the foundation so they understand your work and they support what you currently do. And so you just present what you currently do, and they'll fund money for that. For individual donors, they want to transform the world. They're looking to make a difference. And for them, a lot of them are looking 5 years down the road. They don't want to fill a hole in a program that you don't have money for. And you're like, I need money. We got to do this right away. They're looking for the dream. If I give you this money, how will you be different in 5 years? Right? So they're seeing it more as a business investment. I'm going to invest in you. And how will you be different? So individual donors might be living more into the future, whereas federal grants are in the here and now. I'm giving you money to do this right now, and in 3 years, these are the results you need to have, right? And so it's really important to understand all of those different perspectives and how to write to those different audiences. With federal proposals, you get deep in the weeds, super detailed, lots of acronyms. tons of pages, just lots of info. Foundations, a couple of pages. Donors, 1 page, right? So you got to know how to do Papa Bear, Mama Bear, Baby Bear, and get your message out. And know who your audience is and how deep you go and how light you go.
There was a wealth of knowledge in that response, and I appreciate you sharing that. I think that'll be very, very helpful for people that are thinking about how do I get my program, my organization funded at all these different levels, and just understanding, as you said, like federal is they're trying to solve a problem and you're trying to help them solve that problem. Foundations are, yes, it's like strategies and goals, and are you aligned with those strategies and goals, and how are you a fit with them, and like what is the partnership? And like to that point, just myself working at a private foundation, it is building that relationship with people is so important, and it really helps me to frame that conversation and how you're talking about your work to make it easier for me to advocate for that type of funding. And then yeah, the application processes are a lot different. Like for example, my organization, the process is just 5 questions. That's all the grant application is, just 5 questions, very short. I don't think any of the questions have more than 500 words in there. But when you talk about federal grants, that could be pages and pages and pages of work. So I'm glad that you were able to explain that. And I think like if people are thinking about fundraising, definitely rewind and re-listen to that, because there's a lot of information that you can take and glean and like dig deeper into that. So I appreciate you sharing that.
Mm-hmm. Yep.
Okay. So before we dig more into your wealth of knowledge that you had and experiences in your career, I'd like to ask, what does public health mean to you?
Oh, public health means to me giving people an opportunity to live their best, healthiest life. Right? It's about removing the barriers to people's health. It's looking at systems change, the systems, the policies, the programs, and the practices that need to support individuals' decisions to be healthy.
Absolutely agree with that. When we focus on systems, policies, and practices, and really like thinking about the upstream ways that we can affect change in people's lives is just so important and fundamental to public health. Before we get into the how you've broken out your career into these 3 decades, before getting into that career, you got a bachelor's in Hispanic Language and Arts at Boston University. Why did you decide to pursue this?
So I ended up majoring in Spanish, Hispanic Language and Literature, because I did well in Spanish in high school. That was I did well. And we couldn't afford for me to go on a field trip to, I don't know where it was, Mexico or Spain when I was in high school. And my mother said, take your junior year abroad. And so I always had that in mind, that I would take my junior year abroad when I went to college. And then when I went to college, I didn't know what I wanted to major in, but I knew I was going to go to Spain. That was my goal. And then I realized that the only way to go to Spain for my junior year and graduate in 4 years was to major in Spanish. I didn't want to major in Spanish, but I didn't have a better backup plan. And I wanted to go to Spain my junior year. So that's how I ended up majoring in it. Really, I just wanted to speak Spanish. I didn't want to read Don Quixote and Cervantes and Lope de Vega and all that Spanish literature from the 1600s. That did not interest me. I just wanted to be able to speak another language. That was all. And so there I was majoring in Spanish, which was akin to majoring in unemployment. Like, what in the world do you do with that when you graduate? I had no plan. I didn't know what to do. And at that point, my brother, I have 3 older brothers, and one of them, when he was in medical school, he met Peace Corps volunteers in Liberia. And I was maybe 17 when he was in medical school. And he came home and he said, you need to join the Peace Corps. And he started hammering me from when I was 17 until I was 22. You need to join the Peace Corps. You need to join the Peace Corps. And he was saying that to me in college. And I'm like, I'm not working for free. And then I didn't have a plan because I majored in unemployment. And so I was like, well, maybe I should join the Peace Corps. Maybe then I'll be fluent in Spanish, because I was fairly fluent, but not totally fluent. Maybe if I join the Peace Corps, I'll be fluent in Spanish, and maybe I'll learn another skill that's marketable. And I loved living outside of the US my junior year. And I thought, well, who can pay for that for me to do that a second time? That was so cool. And so I applied to the Peace Corps, and I was very fortunate to have been accepted. I was very fortunate. And so I was sent to Guatemala while Guatemala was in a civil war. There were 10 of us in my group of 50 who were fluent in Spanish. And so they thought, well, because you're all fluent in Spanish, we're going to send you to Mayan villages where nobody speaks Spanish, because you've already proved that you can speak a language. And so we'll send you there and you can go learn a Mayan language. And so that's what they did. They sent me to a village, Comitancio San Marcos, and I started to learn a Mayan language called MAM, M-A-M. I can still say a lot of important non sequiturs, like there's a rat in my house. Oh, look, there's 3 vultures, and I can go buy my food in the market. I'd like 3 eggs, 2 avocados, and a pound of flour. And yeah, so those are the things that still remain 37 years later. But while I was in the Peace Corps, I actually did gain a skill. That was when I first learned about public health. I had never heard of public health as a career. At the time, there were only 21 schools of public health. There were no minors in public health. There were only 21 universities that gave out MPHs. It was still, a career that was starting to build. And it was being in the Peace Corps that ignited my interest in it. I was like, wow, this is the type of work I want to do forever.
Love that. Love that. That is fascinating. And I think it's a good way to start the journey of your story. And I think like it gives hope to people who might be out there thinking, oh my God, I'm doing this bachelor's degree, which is like equal to unemployment in your case. But then still in that, you're able to build and grow. And like to your point, like what is the next marketable skill that I can do? And I feel like even in you saying there was no marketable skill, you learned Spanish or Spanish enough to be able to be in the Peace Corps, and for them to say, okay, you know how to learn a language, go learn this other language with this other community that doesn't even speak Spanish, which is fascinating in itself. But I just love the point of like you having a goal of wanting to study abroad, and that kind of just leading you into taking this degree and figuring it out from there, as well as shout out to your brother for like just putting it in the air that Peace Corps is a thing that you can do. And like to that point, it's just having people around us who are getting immersed in different experiences to say, okay, this is something that you can do, that you can learn from, you can grow from, you can go to another country and learn from. So before we get more into that, what was that first experience going to Spain as a junior like for yourself?
Oh, that was really fascinating. So, I hadn't really traveled at all growing up. Right. I mean, my family, we didn't take vacations. My father took 2 weeks off and we went to the pool, like, the pool in our community. That was it. So for me to get on a plane and move to Spain, that was really eye-opening. What I discovered is that no, people aren't really wanting to live in the US. They didn't really necessarily think highly of us. That's not the story that we tell ourselves, right? The story we tell ourselves is that we live in the greatest country in the world and everybody wants to live here. And then I went to Spain and no, they think they live in the best country in the entire world. And no, they don't want to come here. And they have a lot to say about us and our politics and how we behave in the world. And that was eye-opening. It was really fascinating just to see a different culture, a different rhythm, to see how people really enjoyed life. That they had 8 weeks vacation, that they took naps during the day, and that was encouraged. That they didn't eat dinner until 10 o'clock at night, and that's when the theater began. And then people would go out afterwards and they'd roll in at 5 o'clock in the morning and then go to work. You know, it was just fascinating to see a completely different culture of how they lived, and it felt really comfortable. I just, when I arrived, you know, when I started living there, I'm like, I could live like this. I could live like this. And what I really loved most of all was the accelerated learning that I had to undergo. You know, I am always curious and I love to learn, but you have to accelerate it when you live in a different culture, because you have to know their history, their art, their politics, the most important facts about the country, the language, the style, the fashion, the food. You have to learn all of this, and then you have to assimilate. Right? I mean, I didn't want to walk down the street and everybody go, oh, there goes an American, like, you know, like you're doing it. Right. And I'm trying to assimilate, I'm trying to fit in, and I'm really trying to minimize my accent. Right. So I'm concentrating, I'm really concentrating on how people are speaking, and I'm repeating things, and I'm got a little notebook writing down vocabulary words. And, you know, I had a Spanish friend who made it his mission to eliminate my accent, right? So he would just drill me on things, and we played word games, and, you know, he just took it upon himself, right? And it was a real amazing growth period. And I was 21, right? I was just 21. So I gained this sophistication and maturity in that year. A tremendous amount of maturity, right? We all mature in college, but that was like, there was a huge difference of who I was when I left and who I was when I came back. Very vastly different, vastly different. And then, you know, I had the opportunity to travel, right? So now I'm going to Morocco and going to Portugal and Italy and, you know, all these other countries. And in a blink of an eye, you're changing language and changing money and changing everything. And you know, you have to make all these decisions as a young person and figure out how to get on these trains and duke it out in the language you don't speak. and we didn't have cell phones, and we didn't have the internet, and there wasn't anything you could Google, and there was no GPS. So you were really duking it out, trying to figure it out, which was really fun and exciting, and, you know, a lot of faux pas along the way. You have to figure out how to troubleshoot. And, you know, I didn't have an opportunity to call my parents, so I was all grown up all real fast, right? There was no calling my parents like, hey, do you have any advice? There was none. There was none. You know, I might call them every couple of months, but I didn't have the money to call, so it didn't really happen. We wrote letters.
That is fascinating, but I think it just goes to show like the importance of travel and just experiencing different places and different cultures, to see that people live differently, and there are just so many ways to experience life. And if we always live our life in this one mindset way of thinking about things, it kind of like limits the joy and the wholeness of what life is. So I'm really glad that you shared that, and I can only imagine how difficult it would have been with no GPS, no Google Translate, no nothing like that. So shout out to you for getting through that as well. That's truly amazing. Okay. So we're going to break this conversation into 3 decades. So the first decade is working frontline with Maya Indians in Guatemala, migrant farm workers on labor camps, and adolescents in housing projects and Planned Parenthood in New Orleans. The second decade is about management and understanding large initiatives funded by the CDC and USAID. And the third decade is about leadership, fundraising, and systems change, working collaboratively with partners to change systems, policies, practices, and programs to reduce teen births. Okay, so going back to the first decade. So you shared a little bit about how you got this bug of going to Spain, getting to experience a new culture, and then after undergrad, you became a health educator in the Peace Corps. Tell us more about that experience and how that experience really affected you.
So, Mari, that's a great question. This experience was absolutely transformational, right? Being in the Peace Corps changed my life forever. And had such an impact. It still has an impact on me, right? I joined in 1986. That's a long time ago. And that experience affects every decision I make every day. It affects how I dress, how I live, the car I drive, the career I chose, how I formed my family, the movies I go to, the food I eat, the friends I hang out with, how I travel, where I travel to. Every decision I make stems from that experience. There is nothing more impactful than that. And when you talk to other Peace Corps volunteers, you'll hear a similar type of vibe, right? I mean, it was absolutely transformational. So I joined the Peace Corps and I'm sent to work with Mayan Indians in their village, and we live at the level of the people, right? So you're not making a whole lot of money. You're able to pay for food and housing. My housing was pretty good. I lived in an adobe house. I had dirt floors in the first home that I lived in. I had running water. It was cold, but I put a heating unit on it, and I actually had a flush toilet, and my toilet had a toilet seat. Right. So these are all like little important clues. Not all of my friends lived at that high level. Some of my friends had adobe houses with dirt floors. They had no running water. They had no electricity. Some of them had bucket baths. Some of them only had cold water. Some of them had water, but it was only for a couple of hours in the morning, and they would have to save buckets, right? So all of us were living at a variety of different levels. But I had two different homes. I lived in one village, but then because I was there during the Civil War, we had guerrilla warfare going on in the area that I lived, and I got pulled out of there, and I was sent to a different area, and they didn't speak Mam. They spoke Cachiquel. So everything I had learned in Mom no longer was transferable. And I still had running water and a toilet seat. So I still was able to maintain my same level of living in both of those communities. So that was good. And my feel was, I'm already going to be inconvenienced, because they asked us, do you want a village with electricity? Do you want running water? And everybody was kind of like, nobody wanted to look like they were weak. And I raised my hand. I'm like, look, if you got one with running water and electricity and another Peace Corps volunteer, I'll take it. Because my feel was, this gig's going to be really hard. And if I can get a little creature comfort here, I'll take it. So that's why I had a village, that's why it was like that for me. One of my friends, she was hardcore. Her parents were Peace Corps volunteers before. And she's like, I want no running water, no electricity. And she was pretty happy living like that. I was happy enough with what we had because it was still a really, really hard gig. And we all got parasites a lot and we were sick a lot. So I was happy to have running water and a flush toilet with a lid. So what was it like? When I first started working, I felt like I was dropped in the pages of National Geographic. I just couldn't believe I was working with these beautiful people. And the women I worked with were all in traditional clothing and, with long braids, with ribbons in their hair, with clothes that they wove on backstrap looms, and they carried their babies on their back. And then to become friends with them was just so powerful. And it just shows you that being curious about other people and wanting to develop a friendship, it doesn't matter your level of education. It doesn't matter where you come from. Humans are humans. Humans are humans. And if you can connect on that personal level, it's just so heartwarming to develop the friendships because, these women were looking out for me. They were taking care of me. They wanted to make sure I was safe in the village. And it was just very lovely. You go there with all these big hopes of changing the world, but really you're the one who's changed. At the end of the day, you're the one who's changed. They've changed your life. They've changed your perspective. They've opened your understanding of the world. And what I contributed was so minuscule compared to what these women and children and men in the village gave me. I mean, they just totally changed me for the better, for the better. It was, Peace Corps' tagline is, it's the hardest job you'll ever love. And they're not joking. You have to wake up every day and figure out how you're going to work. There's no real recipe. Peace Corps doesn't give you a recipe. They just send you out there and you sort of have an idea. I'm supposed to be a health educator. And you have to figure it out. There's no boss there. The boss came every 6 months to check on me. So I had to get up every day and work against all sorts of barriers. 6-month rainy season, earthquakes, country in a civil war, strikes, teacher strikes, postal strikes, mudslides that would block everything. I got parasites, and then, people came to visit you. And so every day there was some barrier in your way to get work done. And what you do is you really lower your expectations. You have these grandiose expectations of, I'm coming here and I'm going to teach you everything and I'm going to make your life better. And then you're like, I'm going to show up tomorrow and see if you show up too. I'm going to try to teach this class at school and hopefully the school's open. Right? They taught us how to build gardens, and I had never planted gardens in my life. And I'm like, I'm not doing any gardening. We're not doing gardening. I'm going to be teaching all sorts of stuff. And I got there and I'm like, there's no food here. How am I going to teach you to eat healthy when all we have is corn and beans and onions and tomatoes and potatoes? There's not a whole lot of food, and 80% of the children are malnourished. I think we're going to need to build some gardens. We're going to need to do some gardening, right? So you're constantly readjusting. The one thing I learned in Peace Corps is there's a workaround for everything. I am extremely tenacious because of this experience. I don't ever quit because there's always something that's going to get in your way. There's always something that breaks down. And so how are you going to mount that obstacle? How are you going to jump over it? What's your workaround? And so I don't ever quit. I don't ever quit. People are like, oh, it's not working on the website and we're having some issues. Well, figure it out. Figure it out. Because this has to work. Figure it out. If that doesn't work, what's our plan B? If that doesn't work, what's our plan C? Like, make it happen. Make it happen. Because if I could make stuff happen with an earthquake and mudslides and a coup d'etat and me getting parasites, then surely you could figure out how to make this website work.
Right. It really teaches you like humility and just shows us like all the privileges that we have, and yet still people are like, I can't do this. But like, to your point, it is being in that position, and as you said, like you learned more from them than they learned from you being a health educator. And I think that is really, really impactful and important. And it is a very life-changing experience. And I'm glad that you were able to like build that resilience and take that into your future careers, future career development and endeavors and everything you do. And like just how you think about things is like, okay, let's get this website working. Like, okay, I hear you, but there is a workaround. There's a way to get this done, and let's get it done, which I think is important. And a lot of us do not get the types of experiences. So that must have been very, very amazing for you.
So just on that point, here in the U.S., we have a tool for everything. Right? There's a very specific tool for everything. And so you wait until you have that tool. Well, in Guatemala, you have two tools. You have a hoe and a machete. That's it. And you figure out how to make it happen with a hoe and a machete. So we were building these gardens with the women, The rainy season hadn't begun yet. Our plants started sprouting and we needed to water them. And so we went over to the one water source, but there wasn't a spigot on it to open it. And I'm like, well, there's nothing we can do. We don't have a wrench. And without a wrench, we can't open this. And so I'm like, well, I guess our plants are going to die. And the women just looked at me. They took 2 sticks, they put it around and just snapped open the spigot. Water starts pouring out. And I'm like, well, all right, that's awesome, but we don't have any buckets. Like, the water's coming out, but the plants are way over there and the water's over here. And so I see the women and they're just going around collecting all these plastic bags that had been littered. Well, all the bags have holes in it. I'm like, what are we going to do with bags with holes in it? That doesn't work. They fill up the bags with holes and they run over there and the holes act as a sprinkling system, right? Each step along the way, I'm giving up. I'm like, well, we don't have the right tool here. We don't have a wrench and we don't have a bucket. And now we got bags with holes in it. And then one woman said, give me your backpack. And I'm like, what do you want? Why are you going to put water in my backpack? She put water in my backpack. And of course my backpack leaked. And there it was, perfect sprinkling system with the backpack as well. And over and over again, the women constantly taught me this lesson. Constantly, because every time I'm like, well, we don't have the right thing. I'm like, oh, ladies, look at that. We don't have any plates or forks. I don't know how we're going to eat. And they just started taking plants down in my backyard. And they're like, hey, here's a leaf, put my food here. And then they just started eating it with their hands. And I'm like, I never thought of that. Right. And so what they did is they opened my imagination to solve problems where I was just like, well, I got to have the right tool. Because that's what we learn here. We have our toolbox. We're like, oh, I'm going to go to Home Depot. I don't have what I need. I'm going to go there. Maybe we'll take care of it next week. They just look around and they're like, how am I going to solve this problem? And that's what I learned for 2 years. How am I going to solve this problem, right? Bring in that creativity. How I'm going to solve that problem. Transformative, absolutely transformative. And you learn that as a 21-year-old. Right? That you are unstoppable as a 21-year-old, that you can live in incredibly difficult situations and make it happen. Any job's easy after that. Any job is easy.
Game changer.
Game changer. Right. It's a game changer.
Yeah, and I think to your point, it's like, oh, we don't have the right tool for that. But it's like, okay, so let's make something and like use that as a tool to solve this problem. And like just on the bigger scheme of things, like I can imagine how that like opened up your mind to say, so many people make excuses for not being able to do this because they don't have the proper resources or they don't have the right tools. But it's like, how do we find resourcefulness? How do we build these tools out of what we do have and just work towards it? Because for those ladies, I'm guessing there was no other way. It's like, it's either you do this or you die, essentially. So it's like, let's do it, essentially.
Right. So I think from there, my personal motto got developed, and my personal motto is just do it, damn it.
Love it.
No excuse, just do it, damn it. Make it happen, figure it out.
Right. You shared a little bit earlier that when you were in Guatemala, this was when you learned about public health. And like after this experience, you went on to get your master's of public health at Tulane University School of Public Health and Tropical Medicine. So tell us a little bit about how you found out about public health and then the decision in pursuing a master's of public health.
So I saw the Peace Corps volunteers who were there before me that were finishing their service, and they were applying to schools of public health. And, I'd hear what universities they were applying to, and I was like, oh, that sounds good, right? And, I'd see some of the jobs that were listed, when we'd go into the Peace Corps office, there was a newsletter and you could see jobs that were being advertised. I'm like, wow, that's a job that I'd want to do. And it required a master's degree in public health. So I thought, that's what I want to do. And then I was in the Capitol, hanging out with other Peace Corps volunteers, and a whole bunch of them came back from Mardi Gras. and they were wearing all these Mardi Gras beads. And they were telling all these stories about New Orleans. And I was like, man, I want to go to Mardi Gras. And I tried to go to Mardi Gras, and the Peace Corps wouldn't approve my travel to New Orleans, and they wouldn't. So I was really mad about that. And I heard that there was a school of public health in New Orleans. And there was another new Peace Corps volunteer in my village, and she was telling me about this really great band, the Neville Brothers, and they were from New Orleans, and we had cassettes. And so she gave me this cassette of the Neville Brothers in New Orleans, and I'm like, I think I'm going to go to graduate school there, because I had never lived in the South. I had never had a desire to go to the South. And I thought, but I can see Mardi Gras as a resident and the Neville Brothers. And then I'm going to get on out of there, because I'm going to go work in international health, and I'm going to live around the world, and I'm just going to just drop in. And so those were the high standards I had for my education. I selected Tulane because they gave scholarships to return Peace Corps volunteers, and I wanted to see the Neville Brothers and Mardi Gras, and I accomplished that my first year. And then I thought, wow, this town is really interesting. It's like being in the Peace Corps, except I have a car and a telephone to go with my running water and electricity. But New Orleans was like living in a developing country. The politics there, the culture, the street culture that it has, all the cultural events, it just, like, I had to learn so much to fit in. And I found it fascinating, and I thought, I need another year here before I go elsewhere. And that year turned into 11 years. So I ended up working there, and I just kept trying. I knew I was going to have to leave. I knew at some point that I was really going to need to build my career. And New Orleans, you kind of run out of options. There's plenty of need for public health. There's plenty of need, but it's hard to advance your career. So I just wanted to ride it out as long as I could, because culturally, it's so fascinating. So fascinating. So that's how I ended up in New Orleans. That's how I ended up there.
I love that story as well, and I think that's awesome that you were like, oh, these cool beads, look at Mardi Gras, let me find a way to get there. There's a Masters of Public Health program, so you're able to go there, live as a resident, experience Mardi Gras, see this band that you heard on cassette. It's crazy you're saying cassettes. I'm guessing some people who listen to this mightn't even know what a cassette is.
Exactly.
Google it.
It was before CDs were ever invented.
Right. Wow. And then when you first began in public health, where did you see your path 30 years later?
So actually, when I began in public health, I was interested in sexual and reproductive health. And that came out of my experience in Guatemala, where I was seeing women that had 10 children, and half of them had died before the age of 5. And they were suffering from malnutrition. And the women, when they'd find out they were pregnant again, they were just crying because they couldn't feed the children they currently had. And they had no access to birth control. It just wasn't available. They didn't know it was available, and it wasn't available. And to see them really be struggling that way made me want to work in maternal child health, so that women could have say over their sexuality and over their reproduction, and that children could grow up healthy and live past 5. So I knew that's what I wanted to study. So my MPH is in maternal child health care, and then it was in global health as well. And my idea when I got my MPH was I wanted to be like president of Planned Parenthood, something like that. I wanted to be an executive director. So I always had that as a goal of getting to that point. And sure enough, about 25 years later, I did, right? I was leading a nonprofit organization with a focus on adolescent pregnancy prevention. And I thought, wow, look at that. That was the goal I had when I graduated, and I set myself up and I was able to accomplish it. And I was very strategic in my choices of what I was doing and how I was building my career. As much as it seems like I'm not, like when I, selected Tulane because of Mardi Gras. I do have goals, right? I'm always looking at something. And so every time I would look at a job, I would think about, what do I want to learn here? What are the skills I want to learn here? And how long do I think it will take? Is this a job that I'm going to be in for 2 years? Is this a 5-year job? Is this where I settle for a while longer? Right? But I was always looking at, what do I need to learn? What do I need to do? And I would actually put that list together, and then I would try to set myself up in that tenure that I had at the job to get those skill sets, right? That I'd want to have an elected position in an association, that I wanted to manage a budget, that I wanted to train peer educators, that I wanted to present at national conferences, that I wanted to learn how to supervise people, that I wanted to learn how to fundraise, right? And so I would have this hit list of what I thought I could learn each time I took a job, and to build that skill set.
I think that's important, and that in itself is something that a lot of people can take away from this, because many times I feel like a lot of us go into jobs not really thinking, we just go into a job to just work at the job. But like, to your point, it's like, how can we be strategic? How can we think about what are the skills that we want to gain from this specific job? Or like, what are the skills we want to gain overall? And what are those goals? And how can we get to that point? And kind of working backwards, which is awesome. And I think you're also strategic in choosing your MPH program, because in that in itself, you will be able to live in the South and experience a new culture and see like the work that needs to be done there, and like just that more perspectives of like how people live and how we can impact health, which I think is hugely important. And I imagine that also had an impact on like how you viewed things, especially from a US perspective. So I think that is all important. So this is moving into like decade 2 here. So in the management and understanding of large initiatives funded by the CDC and USAID. So tell us about your career path following your master's program.
Sure. So the first decade was really being on the ground as a health educator working one-on-one. So in New Orleans, I was working in the housing projects and clinics with women that were receiving WIC, Women, Infant, and Children vouchers, and, being a nutritionist there and doing intake. And then I was also working on HIV projects. So I was, giving out condoms and talking about HIV and prevention. I worked at Planned Parenthood. So I was, really working in the sexual and reproductive health realm. I was a college health educator. That was an absolute blast. That was one of the most fun jobs I've ever had. So there was a lot of one-on-one, right? And being frontline. And I remember the first person I met when I came out of the Peace Corps, and somebody set me up with an informational interview with somebody at Save the Children. And I told him what I was interested in. He said, you need to think about being a manager. You need to start building yourself to start managing programs. And I said, I don't want to do that. I like working with the people. He's like, that works out well, and then you need to move into management. I'm like, yeah, I'm not interested in that. But sure enough, after a while, you get a little burnt out on working one-on-one, and you don't have as great as an impact as when you start moving up, because then you're designing larger programs with larger populations, but you're stepping away from working with the frontline target population, right? But at some point, you also want to buy a house and have a family. And if you're working frontline, you'll never have the money for that, right? So as you grow up, you're also looking at other way. You're looking at your personal, how do you want your life to be? Where are you going in your life? And also, how are you increasing your impact in your work? So the second part of my career was really moving into that management side and really moving into public health design. So I was working globally with an organization called JPIGO, which is associated with Johns Hopkins University, and we received USAID money. I was leading projects in Jamaica and Peru, and we were looking at systems change. How are we improving the curriculum in medical schools and in nursing schools? Here it was the 2000s, end of the 90s and the 2000s, and they didn't have HIV written into their curriculum. HIV had been around for 2 decades, close to 2 decades, and they're not educating the up-and-coming clinicians. And Jamaica had an 8% prevalency rate, which was the highest in this hemisphere. And so now we're looking at how do we change that system, right? What are we doing there? Then I started working at CDC, and we were working on a national teen pregnancy prevention initiative. You know, the teen birth rates in the US were incredibly high in the mid-90s, the highest they had ever been. And we were really looking at what can we do to drive these rates down, because teen births are kind of the epicenter of a lot of things that we struggle with in society. Poverty, incarceration, education, high school completion, child welfare. And so if we can delay births into the 20s instead of the teens, we will have better outcomes for children and families, right? If we can just put a pause on pregnancy and delay it, we will see greater outcomes in our country, greater benefits across the board, and huge savings. So I started working at CDC on this initiative. And, you know, as many of us know, public health is very political, no matter what sector you're working in, right? You know, who thought that a pandemic would be political, but sure enough, it was, right? You know, guns are political, tobacco's political, teen pregnancy is political, immunizations have now become political. There are so many aspects of our work that it's not necessarily for the good of the people, and people are fighting on both sides of it. And so I worked in teen pregnancy prevention at CDC under the Bush administration. And that administration was about the ideology of abstinence only until marriage, which is not science-based. And so to work for a federal agency that's all about science and not be able to talk about the science was challenging. It was challenging. And we tried our very best to fly below the radar of really setting up systems in the US that could start instituting evidence-based programs and practices, right? And so we were really building that. We were pilot testing different ideas, and we got a body of science of really being able to say, this is what works. We've been able to show this is what works. And so when Obama was running for president, a lot of people in the field of teen pregnancy was talking to him and his team and telling him about what works. And so the first thing that President Obama did when he came into office was set up an Office of Adolescent Health and fund it with $170 million a year to use the science that we had developed as CDC as the foundation that then got disseminated across the country. And so now organizations were actually being funded to do what works. And what we started to see was this major alignment between the Office of Adolescent Health, CDC, Title X funding that goes to clinics that serve teenagers, the creation of Obamacare, which then provided contraceptives at no cost to women for the first time ever. So an IUD that used to cost $1,000 now costs nothing. So the most effective form of contraception was now available at no cost. And then there was a whole lot of training on teen-friendly clinics and a lot of education going out about the most effective forms of birth control and making it available. A lot of information on comprehensive sex education and schools taking that on. And so we really started to see systems change, because what it comes down to is, how do you prevent a pregnancy? Well, you either don't have sex, or when you do, you use contraception, right? That's it. That's it. But if you can't get to a clinic and the clinic is only available when you're in high school, and it doesn't have hours at night, and the best form of birth control costs $1,000, it doesn't matter how highly motivated you are to protect yourself. There are so many barriers in your way. And if you need to get your parents' permission for this, then how is it that you can make the best decision for yourself? So one of the things I always said was the greatest barrier to teens preventing a pregnancy is the adults who love them. That's the greatest barrier, because the adults who love them are saying that we're not going to teach sex education in schools, because if we teach it to you, then you might have sex. And we're not going to have the clinics open at the time that you're available because we want to eat dinner with our families. And we're not going to make it affordable to you because we have insurance companies that want to make money. And so all of these adults who don't want to see teens pregnant aren't making it possible for them. We did a survey with pharmacists because Plan B now became available over the counter, right? It wasn't available over the counter. And when we said, would you make this available for a teen? The response was, well, if they deserve it.
Wow.
What do you mean if they deserve it? You've got a teen coming in saying, hey, I'd like Plan B. And they're like, well, if they didn't use a condom, then they don't deserve it. But if they used a condom and it broke, then okay, then I'll give it to them. And if they're not 13 or 14 years old, because they shouldn't be having sex, but they're more like 18 years old, then I'll give it to them. Right? So we have these attitudes that adults have that interfere with young people getting the care that they need and deserve and have a right to. And so there was a whole lot of systems change going on where we were aligning funding, programs, practices, and policies. And in that time, the birth rate just took a nosedive in those 8 years that President Obama was in office, because that was the biggest investment we ever made. CDC made it their winnable battle. There were 10 winnable battles, and teen pregnancy was one of them. And their feeling was if you put the money behind it, the strategy behind it, and had a science-based approach, you can get the results you want. And sure enough, we were able to prove that. And so, I don't have the data, accurate, but there was like a 40% decrease in teen births just in that 8-year period alone. And in the whole time from 95 until currently now, the birth rate has dropped over 70% in the US. I never thought that would happen. I never thought it. We were seeing birth rates of 60 per 1,000 or more. And now it's like 10. It's 10. I mean, it's just incredible. It's just incredible.
That is incredible. And thank you for that work that you've done. I think one of the important things that you highlighted there is that even when you're working for the CDC, like there are the political aspects of it, but you all didn't say, okay, let's not do this. You said, let's do this quietly. And then when the political things changed, you already had all the science and everything backed up to say, okay, this is what we need to do right now to affect change. And thankfully, there were leaders out there to say, yes, let's build this. I think you said it was the Office of Adolescent Health, and let's work towards getting this. And like from that work, it was able to really instill more systems, more policies, more practices, where we're not deeming sex as irresponsible, because we know people are going to have sex regardless. It's like, what is the best public health approach to this? What's the best harm reduction approach to this? Because to your point earlier, it's like when we have a lot of teens having babies, those have a lot of societal implications and familial implications. So like, how can we best and systematically work towards not having that, which I think is awesome. So kudos to you, and like shout out to that person that said, you know, you can't just work on the front line. You have to step into these managerial roles so that you can really make greater impact. Because without that, you wouldn't be able to see these types of changes. So I'm really happy that you're able to share that story, and I think that just goes to show like how important it is to have all this work in the background when things aren't the right time. So when things are the right time, you're ready to move and ready to get things going. So I appreciate you sharing that.
And I want to just talk about some collaboration. So when I left CDC, I then led a nonprofit organization called the Georgia Campaign for Adolescent Power and Potential. And so, you know, we had this focus on teen pregnancy prevention in our state. And so we pulled together a collaborative, you know, a collective impact model where we were looking at, you know, all of us working together, aligning our work and aligning our funding behind this one goal of reducing teen birth rates, right? But everybody had a different piece of the pie. So we were looking at how are we building up our clinics and making them teen friendly and changing the hours there. And we were working with the Department of Juvenile Justice of how do we make sure that there's contraception available to young people when they leave the juvenile justice system. And, you know, we couldn't crack the nut totally, like have the best forms there. So it's like, okay, plan B was what's the referral system so that they can get it outside of DJJ. And then we had child welfare, which is our Department of Family and Children's Services, working with DJJ, because a lot of the children that were in foster care may have also been in DJJ, right? And so, you know, there's a higher birth rate amongst youth that are in foster care, but there was no education for foster parents to be able to talk to the young people in their care, and there was no education for the young people in foster care. So we changed that system to make it available there because we knew that was a high need population. Then we started changing the policies in school districts that had an abstinence only policy, and we were able to change that to a more comprehensive sex ed policy and train the teachers. And so we work together, the Department of Ed, Department of Public Health, the Division of Family and Children's Services, the Department of Juvenile Justice, United Way, Emory University, Morehouse University, GCAP. There were like 20 of us that worked together to put our strategy together and pay attention. And we set a goal to reduce our teen birth rate 1/3 in 10 years. And we reached it in 5 years, which is unheard of in Georgia. Unheard of. And so we were really excited to have that impact. And it was because of this collaborative on steroids, right? There was a lot of money coming into our state from Obama. And then we just kind of built that strategy and everybody got behind it. And we were really excited about it. So, you know, when you're looking at systems change, it's a huge collaborative effort. Right? There's policies with a capital P that have to be changed, but those are voted on. And there's policies with a little p of, well, we've always done it this way. Well, why? And why don't we just change that? Right? You've got to invert the burden. You know, the onus is on people. And you have to invert the burden and put the onus on the systems and dismantle the systems that are keeping people down. And you have to really examine it because you may not see that these systems were built on purpose or not on purpose, but they're having a negative effect on the population you want to serve. And it's very important that we take a very deep dive in our systems, our policies, our practices, our programs, our funding, and how we can invert that burden so people can access their best health with the minimum amount of barriers thrown in their way. Like I was telling you about teens, right? There were just insurmountable barriers that adults put there. The adults who love them, who don't want them getting pregnant, right? We have barriers right now on gun control. We don't want people ending up dead. But it's happening over and over because of the systems we've put in place that we do not want to dismantle.
Very, very
And until
true.
we dismantle those systems, we're going to continue looking like we do and not look like all those other countries that don't have those same systems in play. And they don't have their people dying from guns because they have a way of making sure that people have access to their best health. We don't. We have politics that get in the way.
Sadly, that is the case. But yes, I think it is important to highlight just how important that collaboration, that collective impact, and just coming at issues, especially these intersectional issues from different perspectives and different regions of power to say, okay, you have the DJJ, you have the Department of Education, Department of Health and Human Services, like what is your part? Where are your systems coming into play that are holding people back or not giving people easy access to their best health? And I love what you said about too much time you put the onus on people when the onus is on the system. It's like why aren't we looking at the system and understanding, okay, it's not the person that is having this outcome, it's the system that's creating the outcome for this person. So how do we change that system so that this outcome is not the outcome, or to reverse it, how do we change the system so that we are getting more of the outcomes that we want? And that is hugely important. So wow, I think like that is very inspiring to hear that, and I hope that many people listening to this podcast right now are able to get inspired and motivated and fired up to have that type of systems level change, because we need it because as much as the great work that you've done, there's so much more great work to be done out there, and so many more systems that need to be changed or dismantled, and really to give people an opportunity to their best health. So I appreciate you sharing that. And now moving into decade 3. So the decade around leadership, fundraising, and systems change, working collaboratively with partners to change systems, policies, and practices and programs to reduce teen births. Well, I guess you spoke a little bit about that, but like the other parts of it. So continue on in your career path and the strategic decisions.
Sure. So we touched a little bit about the strategy, right? And about the systems change with collective impact. But the other thing is, the last 10 years of my career, now I'm really leading, right? I was the CEO of the Georgia Campaign for Adolescent Power and Potential. And just 2 months ago, I started as the new CEO of the Migrant Clinicians Network. So these are 2 nonprofit organizations. And so in the position of leadership, I'm not doing the technical work now, right? The technical work is being done by the senior leaders and all of the staff under them. So my role now is to remove the barriers for the staff to get the work done. So I'm looking at what are our systems in our organization that's getting in the way, right? Looking at salaries, benefits, our evaluation system, our grant system, our strategy for going after money, our fundraising, who's on our board, how are our board members influential, how are they opening doors for us in places that we don't have access, right? Because we have access in public health, but they're business leaders. They might be working in media. They might be politicians. They might be lawyers. They might be in HR, right? And so they provide additional in-kind services or open up opportunities for us. When I worked at GCAP, we had support from Turner Broadcasting, and they would make videos for us. And, we had people who could help us write blogs and put them on the Huffington Post or put in the New York Times, and, would really give us access to that. I had a philanthropist who was on our board who had access to philanthropists throughout Atlanta who wanted to come to our gala. And so that gave us access to power and wealth of people who wanted to support our organization. And so as a leader, you're now looking at how do you open more doors for your organization? What's the vision of where you want to be in 5 years? Where do you want to be in 10 years? How are you demonstrating impact? How are you demonstrating that you're a solid organization for people to want to donate to? And so it's taken me out of the direct services, or it's taken me out of the technical work, but it's really pulling on my strategic skills, right? It's all about being a visionary and being strategic. How do we get there? And it's about inspiring people to follow that vision, right? How are you a motivational and inspiring leader that people want to follow, they want to stay there, and that they see a place for themselves? They can come as their authentic self. They can learn to be a leader there, and they can grow their skills. And how do we provide those opportunities for people to start building their careers? Right. And so a lot of times I reflect on, who were those people who helped me, who cultivated me? What were the jobs I loved the most, and why did I love them? Why did I stay 2 years at this job, but 7 years at that job? Right. And how do I make sure that I'm creating an environment where people are like, I love coming to work. I love what I do here, and they see a role for themselves. Because in order for us to get impact, you have to have people that have longevity there, right? You need a mix, but you need a mix of people who are there, who understand the work and they're technical experts. And then you need new people coming in who are coming in with new ideas. They're like, oh, have you heard of Smart Sheets? And have you heard of this system? And hey, what about that? Right? So you need new people bringing in new ideas. And then you need the people who have been there for a number of years who understand how the organization works and are experts in the field, right? And you always need to have that balance, but you can't have a constant churn, and you can't have people sit there forever, like all the same people sit there forever, right? You've got to have a mix of both. So you always have innovation and stability. Got to have innovation and stability. Otherwise you can't move, right? Then you can't get off of square one.
I'm happy that you highlighted leadership and working to remove barriers, into opening doors, into measuring large impact and demonstrating impact. I think those are really, really key things to understand as you shift up the ladder into those more leadership positions. So for yourself in your career, you have been at the front line, you've been a manager, and now you're in this what they call executive suite of leadership, some people would call it. What are some tips that you'd give to people as they move up those ladders in having more responsibility in an organization?
So it's important to understand your leadership style, right? It's important to understand what are your greatest strengths and what are your greatest weaknesses. And typically your greatest strengths are your greatest weaknesses, right? My greatest strength is I move quickly, I get stuff done, I'm energetic, I'm really motivated. But that's also a weakness because I will steamroll you to get it done, right? And I move really quickly. And for people who need thought, that's a faster pace. I come in with a lot of energy. So for introverts, I bowl them over, right? So you've got to understand your strengths and your weaknesses, and you've got to understand how to adapt to different people. How do you lead a group? And how do you work with people individually? And you constantly have to mitigate your weaknesses, really try to cover for your weaknesses, have other staff that can cover for your weaknesses so that you're playing in your strengths and that you're also setting up cover for them, that their weaknesses are not being highlighted, that somebody's covering for them, right? So it's really about how do we elevate everybody's strengths and how do we downplay weaknesses, right? Because nobody's coming in, everybody, you come in with a mix, right? So know who you are, know what you're good at, and know where you want to go. And for me, I had that goal of I wanted to be an executive leader. So all along, I knew I needed to learn how to manage people. I needed to learn how to manage budgets. I needed to learn how to get money. I had to get results and publish results and present results. Right. So that was what my hit list was. But I also wanted to learn about HIV and I wanted to learn about sexuality. And then I wanted to learn about collective impact. And so I was building a skill set. And I was also working in a variety of settings. I worked in housing projects. I worked for Planned Parenthood. I worked for 3 academic institutions. I worked for a federal agency. I worked for CDC. So that whenever there was a job that came up, I had such a wide skill set. I didn't pigeonhole myself to only work in a state health department or only work for CDC or only work in one place. And so for me, that worked out well because I always wanted to be employed. I just didn't want any gaps. I didn't want any gaps. I wanted to be employed. And so I was just making sure that I had a wide enough skill set that I could plug in different places, right? And I would work with different populations. So I worked with Native Americans. I worked, with adolescents. I worked with migrant farm workers. I worked in housing projects, to be able to demonstrate that I had cultural fluency, that I could work in a variety of environments, that I knew how to change messages. I was working with super wealthy people and, the poorest of the poor. And I could adapt to a variety of environments to show that I had that type of fluency.
Awesome.
And that was just kind of my way of tackling my career. Other people are like, I'm an epidemiologist, I'm only going to do this, right? But that was just how I approached my career.
Yeah, I think more people lean on that than saying they want to be in this track. So I appreciate you sharing that valuable information. And given your extensive experience and your career, what has been frustrating to you in public health?
So I think, the worst day of my life in public health was when I was doing this collective impact initiative. We had all agreed on our strategy. We all agreed we were going to put our money behind and align it behind that strategy. Huge opportunity came from CDC. It was like $2 million coming into Georgia. The Department of Education needed to apply for it. They were well positioned. I said, I'll even write your proposal. It'll be a winning proposal. And I wrote the proposal. I was just in the latter part of honing it down, and the governor pulled the plug on it and said, we're not applying for this money. The money was for comprehensive sex education in schools, and we're not going to apply for it. We don't want this money. We don't need this money. And I was devastated because here it was for 3 years. We'd all been working on this. We'd been moving in this direction, and to have the governor pull the plug. And I was trying all sorts of backroom deals to see if we can change it and get it done. And it was a done deal. And I just thought, God, this is a sham, this whole collective impact thing. We all agreed and it's actually a farce. And I was just like, this is a joke and I don't even know why we're doing this. And it was a bad day. And my mentor and the woman who was our facilitator said, Kim, some days in a collaborative, you hit a wall. But that's not the end of it. You just find something else. There's a plan B. You figure out what's your plan B. Like, how are you going to come to the table, everybody knowing that this is what happened? And how do we move forward? And so she, talked me off the cliff, and we went in to figure it out. So, what's my big frustration? My big frustration is that public health is politicized in this country. That's my, that's my biggest frustration is we've got policies that interfere with people being able to access their best health. It was very hard to watch COVID happen. And the downplay of it when this was a massive pandemic that killed 1 million people in this country, including my mother. And to see this take place and what was happening at the leadership level from our president was shocking. I mean, there are no there's just so many vocabulary words, but it was just shocking to see this. And to know that in 2018, the public health budget was decimated. It was cut in 2018. So we were completely ill-prepared in 2020 because this field wasn't valued for its importance in saving lives.
Yeah, and I've heard similar stories. So condolences to you on your mother, and I hope that and us seeing that leadership and the lack of investment and lack of just understanding of science and wanting to put people first. I hope that people listening to this put into leadership positions and advocate for things that never happened the way that they happened during the pandemic, because it truly was sad and it truly was really hard to watch as a public health person throughout that time. And yes, I know like the CEO for the organization I work with had a similar experience with just leadership. She was in a state position, and then the government changed, and they wanted to dismantle all the work that she did, and that like the politicalization of public health, and just how just like leadership can really impact the work that you're doing could be very disheartening. But I'm glad that you're still out here, and shout out to the facilitator, your mentor, that like sometimes you do hit a hard wall, but but going back to like the Mayan ladies you worked with, you just keep going because you have to keep going. Just do it, damn it, right? So, love it. Okay, so I'm going to move you on to the Furious Five, the 5 questions that I ask all guests. Okay, number 1, what advice would you give to a student trying to pursue a career in public health?
It's a noble career. Keep going. Keep going.
Love it. Number 2, if you were talking to someone wanting to get into your position, what advice would you give them?
I would say start working on your leadership skills and really learn the very critical things that you'll need for that role, right? Managing people, visioning, strategic planning, fundraising.
Love it. Number 3, what's something you are working on improving in your life right now?
Better habits. I think, COVID and downtime and working from home has diminished some of my habits, some good habits. And so I'm working on, you can't change them all at the same time. You've got to make little incremental changes, little tiny habits. So that's what I'm working on. That's cleaning that up.
That's real. COVID has really impacted us in so many different ways. That's for
sure.
Number 4, professionally, do you recommend anything?
Yep. Build your network. Public health is a very small pool, and you will be running into people over and over. Don't burn bridges. And cultivate your network, right? Stay in touch with people, just check in with people, comment on stuff on LinkedIn or elsewhere. Just build your network, because at some point You may lose your job for whatever reason, and you're going to reach out to your network and say, hey, do you know anything? And if you've been cultivating your network and they know you and they love you, they'll let you know of something, right? And you never know who's going to open that door. And the same thing is they're going to be reaching out to you. Do you have any resources? Do you know anything? It's a two-way street. So always build your network, because you're going to be reaching out to them in your current job of, hey, do you know anything about this? And can you connect me to this person? I mean, I'm always asking for warm intros, and I do the same for other people. Networking is paramount. It's all about relationships.
Great advice. And last but not least, where can people connect with you, Kim?
I'm on LinkedIn. So you can find me at, I think it's Kim M Nolte on LinkedIn. And that's the best place. I'm not on Twitter.
Most people are moving off of Twitter these days. So
yep, I'm on LinkedIn.
Fine.
You can find me on LinkedIn.
Awesome. Well, thank you so much for coming on and sharing your extensive knowledge and experiences and perspectives with us. I definitely learned a lot and got a lot of value from your perspectives, and I'm sure that people are listening or watching this also did. So thank you so much.
Thanks so much, Amari. I really appreciate it. And I hope to connect with some people on LinkedIn. I'd love to meet some new people, learn what people are up to. And, please be sure that, if you want to connect with me, also send me a DM. I'd love to just hear from people.
You got the open invitation, everyone.
Thank you. And Amari, I really appreciate the opportunity to just share my experience in public health. I remember when I got my degree and I'd meet people who had been working for 10 years or 20 years. And I'm like, wow, that's a long time. And sure enough, here I am. It goes by very quickly, and it's an incredibly fulfilling career. So congratulations to everybody in this field. And I look forward for you keeping us all healthy.
Yeah, thank you. Housekeeping items, everyone. Thank you all so much for listening or watching to this. Be sure to leave a like if you're watching this on YouTube. Be sure to subscribe, whether that's on YouTube or any podcast platform that you're listening to. Leave a 5-star review and share it with a friend who gets some value from it. Kim dropped a lot of great information today, so definitely share it with someone. Appreciate you all. Bye.